You are most welcome to today's talk. It's Thursday evening, the 15th of July. Now, a bit of news from the UK and the United States and a bit from the Middle East today, and then we've got a report from Brazil as well. So a few areas of concern really. Now let's start off with the UK, where the picture is really a bit complicated really in terms of the high number of cases. So cases in the UK, the last 24 hours, I mean, best part of 50,000 new cases, 48,553 new cases. And when we look at the graph, I mean, this was the Alpha variant wave, the UK Kent variant, and this is the Delta wave. And in terms of cases, we're kind of getting up to where we were with that high wave back in January. So cases are absolutely scooting up. As of course we anticipated several weeks ago. We did predict this would happen, and it is happening. And again, if we look at the figures here, we see basically red all over the place. So the vaccines are going okay, 87.5% first dose, 67.1% second dose. But the people testing positive, the death was in 28 days of a positive diagnosis, patients admitted, all going up. So we did anticipate this. As I said, we anticipated this, but it's always it's actually quite high numbers, quite daunting numbers when you see it. Now, of course, it's not the number of people testing positive that really matters. It's the number of people being hospitalised. But of course, there's a delay. There's a 3-4 week lag in this. The doubling is much later in hospitalisations compared to cases. So if we look at hospitalisations at the moment, we're actually up to 582 admissions in the past 24 hours. So again, that's reasonably high. But when we look at the graph, so this is actually about 582 there over the 24-hour period. I'm not sure the last bar's on that graph actually, but that's round about there. But compared to the hospitalisations that there were with the Alpha variant wave, nothing like as bad. But of course, because this is going up here and the link between increasing cases and hospitalisations and deaths has not been fully broken, we do know that this will go up. Now, it's a big question mark how much this will go up. I'm hoping not more than I've just drawn on there. Well under, we're hoping for under 1,000 cases per day, but it could go over 1,000 admissions per day. That is possible. So talking about the situation in hospitals, now the northeast is particularly bad at the moment, I'm afraid, for cases. So this is a respiratory physician from the northeast, from University Hospital of North Tees. People are still critically unwell with it. I cannot quite believe we're back at this stage again. It's really worrying. Now, to be fair, this physician is in a particularly high risk, not high risk area, but a high prevalence area at the moment, which is obviously, as the staff are, of course, really quite upset that we're now going into a third wave with some increase. Other parts of the country are nothing like as bad. But in this hospital, 22 COVID patients, 5 in intensive care. Average ages are lower than during the first two waves. Now, this has been a report from all around the world. Younger people are being affected now with this Delta wave than they were before. But that's, of course, partly because the Delta wave may be doing this. That's quite possible. We don't have firm data on that. But also, of course, because there's so many cases, a lot of the older people are being vaccinated now and have high levels of protection, but there's so many cases. The sheer number of cases means that in the unvaccinated groups, or the groups where they're waiting for the vaccine to take effect, there's bound to be a higher prevalence. So that's probably why we're seeing more young people. Although this does seem to be a report from around the world, and even in unvaccinated areas such as African countries, there does seem to be more young people being admitted in this wave than there was in the previous wave. So that is kind of where we're at with that. 2 seriously ill in this hospital, under 30, both unvaccinated. So young people becoming seriously ill in these two were unvaccinated. Visit to adult wards is suspended, and of course this is particularly difficult with elderly relatives, people in terminal care, and an appalling situation that people can't visit their relatives who are ill at the moment. Patients are believed likely to go in increasing for the next few weeks. So it's the 15th of July now. We've got this unlocking on the 19th. So these patients the numbers are expected to increase for the next 2 weeks at least. Behaviour of local communities from the 19th of July will determine how serious the challenge will be. And this doctor, again, we are praying that the public do maintain some sense of perspective on this, somewhere between everybody being locked down and getting what they want. So we have to open up gradually. We've said this several times over the past few days, but we'll say it again. If people go completely back to pre-pandemic behaviours, hospitalisations could easily increase to 2,000 per day, which is not really sustainable. If people carry on behaving as they have been, what is almost a temporary new normal, then we would hope to keep the cases well below 1,000 per day that are being admitted. There's quite a lot of indications that people that are being admitted on the whole aren't as sick. Now, I know we've talked about these in this one hospital, 5 in intensive care and 2 seriously ill below 30. But as an overall trend, people seem to be getting less sick, but still sick enough to be hospitalised, which is the concern. So we really have to carry on. After the 19th, when we have this legal liberation in the UK, we've got to carry on with mask wearing, social distancing and good ventilation. Have a party, but have it outdoors. And no excessive intimacy, of course. COVID symptoms study. Let's look at that. COVID symptoms study app. So now this shows a pretty high prevalence. 486,000, best part of 500,000 people predicted to currently have symptoms in the UK from the COVID symptom tracker data. And the number of new cases there is somewhat lower. So this is interesting. So it looks like if these both data sets are correct, which of course there might be inaccuracies in this one, because this is an extrapolation, but it looks like there's more people testing positive than are symptomatic, which would explain that discrepancy, which is encouraging. And day by day evolution of infections across the UK in terms of prevalence, in terms of symptomatic cases, we can definitely see a slight plateauing there. So we had this rapid increase with the Delta variant. That was the Alpha variant wave, of course, there. And now a slight plateauing in symptomatic cases as reported to the COVID symptom tracker app. So some signs of encouragement filtering through here, that a lot of the people that are testing positive are going to be minimally symptomatic or asymptomatic. But of course, these data sets are derived in different ways, so there could just be disparities between the data sets. Well, having said that, I mean that the COVID symptom tracker app data is taken from 1 million people and it has been pretty accurate so far. So that is a tone of encouragement, a bit of encouragement there. Unvaccinated people in the UK. Now this is interesting. Unvaccinated people in the UK. 17,000. 17,000, that shouldn't be there. 17,588 new symptomatic cases of COVID-19 on average, based on PCR data tests over the past few days, over the past week. So about 17,500 new daily symptomatic cases of COVID on average in people that aren't vaccinated, based on about 10,000. So that's based on 1 million reports and 10,000, about 10,000 PCR testing. Now, last week, it was 22,683. So symptomatic cases in unvaccinated people are down 22%. Interesting. So what is going on here? So rather than listen to my opinion, direct quote from Professor Tim Spector, suggesting that the wave in the vaccinated population has now peaked in the UK. Interesting. Suggesting that the wave in the unvaccinated population has now peaked in the UK. Now, I'm going to put a question mark on that because I think it's fairly optimistic, but it's still pretty encouraging. We will be watching that closely, of course. Vaccinated people in the UK, 15,537 new cases. So just remind you again, unvaccinated people, that number of new cases, 17,500 unvaccinated people. But in vaccinated people, 15,500 new daily symptomatic cases in partly or fully vaccinated people. Now, this is slightly concerning in a way, because we're getting a lot of people that are symptomatic after the vaccine. But the symptoms have changed to being more like common cold symptoms. So the most common symptom is, you go from the top, it's quite easy to remember. Most common symptom is headache, then runny nose, then sore throat, and then sneezing. They're the symptoms that most people are getting COVID tested when they have those symptoms. And then they know to isolate if they have those symptoms. Once they've got the positive test, they would self-isolate till they got the positive test. The trouble is, we've got so many cases now. There's about 500,000 people who've been pinged on the NHS app and ordered to isolate for 10 days. And this is really affecting the workforce. And yet the unvaccinated people are usually getting this, in the vast majority of cases, this minimally symptomatic disease. And yet some companies are really struggling because we've got 500,000 people that are self-isolating. So really is a case there for changing the rules for those that are doubly vaccinated, because of the effect it's having on the workforce. And some industries are really struggling because of this. And yet we have to obey what the COVID symptom tracker app is saying. That will be changing in August, but it's not changing yet. So interesting to see if the government chooses to act on that. Last week, infections in vaccinated people were 11,000, up 40%. So 40% more vaccinated people getting symptoms. Unvaccinated people, 22% less getting symptoms. Right. And that takes us on to the next sort of thought. Again, direct quotes from the COVID app. With cases in the unvaccinated group continuing to rise, cases in the vaccinated group continuing to rise, the number of new cases in the vaccinated population is set to overtake the unvaccinated in coming days. Now, I suppose this is good because it means a lot of people are getting vaccinated, but quite an interesting turn of events. So next week in the UK, we can fairly confidently predict that there will be more symptomatic COVID infections in the vaccinated than the unvaccinated. Interesting. This is probably because we're running out of unvaccinated, susceptible people to infect as more and more people get vaccinated. Well, that's good because it means the community herd immunity is increasing quite rapidly. Now, if this is working out, that indicates that the government is probably right, and the 122 scientists who expressed severe concern on the video we did a few days ago may be over cautious. But we don't know that yet. We're still. This is the UK experiment world. Watch us and see what happens. Whilst the figures look worrying, it's important to highlight that that vaccines have massively reduced severe infection, and post-vaccination COVID is a much milder disease for most people. So the people are vaccinated get fewer symptoms for a shorter period of time, and they're less severe, and they are more common cold-like coryzal type symptoms in nature, which of course we're rather used to living with, aren't we? So again, direct quote, the main concern is now long COVID. So COVID symptom tracker app and the Tim Spector group are now mostly concerned with this high level of cases about long COVID, particularly in the unvaccinated. Now, the degree to which vaccination, so if you're vaccinated and you become symptomatic, the degree to which you're at risk from long COVID is not known at the moment. That's by no means clear. But what the COVID symptom tracker app, it's almost certainly way, way, way less, but we don't know that for sure yet. We're expecting it to be way, way less. But anyway, prevalence, one in 142 people in the UK currently have symptomatic COVID, and the R value is estimated at being 1. Now, getting back to the long COVID, so very high prevalence. 1 in 142 people are currently symptomatic, and pretty soon it's going to be more vaccinated people symptomatic than unvaccinated. But because of that plateauing, they believe the R0 is actually 1 now. Now, of course, that is inconsistent with the data, the official data from testing. But of course, this is symptomatic patients. Is that what's making the difference? That is our hope. That is what's making the difference. Now, Tim Spector's very worried about long COVID. He's estimating that 550 cases a day are developing in the unvaccinated people. So it's the unvaccinated people he's worried about from getting long COVID. 550 people a day. Now, these are people that are just being infected today. Now, of course, these haven't got long COVID yet because the long COVID is symptomatic. It's people that can't return to normal activities or work or normal activities of daily living after 12 weeks. But statistically speaking, this 550 who are getting the first symptoms today will not be better after 12 weeks, is what he is saying. And that's based on the figures that they gave. 1.2% at the age of 20 are getting long COVID, of those who get infected that are unvaccinated. 4.8% at the age of 63, and a gradation in between. So based on those figures, 550 cases of long COVID a day. Are they going to get better after 13 weeks? Or are they going to still be symptomatic a year or two later? I'm afraid we don't know that yet. Next couple of weeks, they did highlight the Euro Football Championship. Now, this Delta variant is so contagious that there has been cases of people spreading it outside. So that is going to be one to watch. Were the Euro Football Championships the biggest mass spreader event in British history? We'll know this time next week, because if there were cases, it's going to start increasing in the next few days. Now, moving on to the United States. Cases in the States, 31,000 a day, a few days ago. It's always frustrating how delayed the CDC data is. And there's the graph. So there's definitely an increase. So that was the previous wave in the States. And this wave is definitely picking up. Now, I've just made a few notes about the States today. It's a bit short on preparation time, but interesting. So the United States, the Delta variant, first identified in India, is now 58% of cases. 58% of cases are Delta variant, of those that are sequenced. Of course, they're not all sequenced, but they do sequence a representative number. 58%, pretty high. Now, in April, it was 0.1%. Now it's 58%. In other words, the Delta variant has done that between April, May, June, July. And to be fair, on this channel, we predicted this in April. Unfortunately, there wasn't a great deal of proactivity, and now there's a degree of reactivity, I'm afraid, as we've come to expect. So there's this summer spike. The last week, cases have actually doubled in the States, 109% increase in the last week. Overall positive tests. Hospitalizations are up 19%, deaths are up 17%. So there is definitely a summer spike in the United States. Missouri, a very low vaccinated state, there's actually more people in hospital in Missouri than there were at the height of the second wave last winter, which is concerning. Overall in the States, vaccinations are actually down 54%. So there's still a lot of people getting vaccinated in the States, but the daily number is way, way down. The other thing I saw on the news is Tennessee is going to stop adolescent vaccine outreach. Now, okay, you could argue about that, but it just disappoints me the way it's become such a party political issue in Tennessee. So cases in the States are going to go up in August, September, October, I'm afraid. And Los Angeles County, for example, the cases have gone up particularly highly. So that was just a few things that caught my attention from the States. But the big news there, Delta variant 0.1% in April, 58% today, Thursday. But of course, because the Americans are a bit behind, so that is Thursday data. 58% Delta variant, which means, I'm afraid, it's going to pretty soon become 98%, the same as it is in the UK. Now, I'd like to focus on particular parts of the world, just to give us a sort of orientation of what's going on generally. So I want to do the look at the Middle East today. Spread of the Delta variant in the Middle East. Now, Eid al-Hayya next week. Basically, this is a post-Eid festival, and it means people travel around the countries, largely Muslim majority countries, of course. So that is going to spread a lot of infection around in the Middle East, unfortunately. No real question about that. World Health Organization have said current COVID-19 upsurge may continue to peak in the coming weeks with catastrophic consequences, talking about the Middle East. Direct quote from the regional WHO representative. Not weak language. Catastrophic consequences. So let's look at this. Well, there you go. Tunisia, wow. Quite an increase in cases. Now, the WHO have said that cases in Lebanon and Morocco will increase over the next few weeks. The report didn't give details of how they know that. Presumably it's because of the incidence of Delta variant, and that's predictable. Now, I've left the United States in there, which of course is not in the Middle East, just as a comparator. Iraq and Iran both increasing, Delta variant driven. Libya and Tunisia with huge numbers of cases there in North Africa. So that's cases per million people. Cumulative tests per 1,000 people. Well, this is the testing in the United States. This is Lebanon. And look at this, Tunisia, Morocco, Iran, Iraq. Just compare that to the level of testing in the United States. So that means that the number of cases here being reported is a gross underestimate because the testing's simply not being done. So just to remind us there, so Iran, Iraq, Morocco, Tunisia, all of these will have much higher cases because of the very low testing. And so testing's actually lowest in Tunisia, and yet the cases are highest. So what the actual prevalence in Tunisia is at the moment, it must be absolutely horrendously high. And of course that's going to filter through into sick people in the next few weeks because the rate of vaccination is relatively or very low. So health services are going to be overwhelmed. This is a pattern we recognise so well now, unfortunately. It is quite inevitable to be another India type situation. Let's hope people in power start acting as proactively as they can at this stage. So a cumulative test there, stark difference. Cumulative vaccine doses per 100 people. Well, again, look at this: Iraq, Libya, Iran, Tunisia, Lebanon, Morocco compared to the United States. Very low levels of vaccination. Work it out for yourself. Very low levels of vaccination. Very high prevalence rates of Delta variant. You don't need me to spell that out to you. You know what that means now. So, and already deaths, well, look, it's already happening in Tunisia. The deaths are already high. And I think we can say with confidence, because of the increasing cases, sadly, they will go much higher compared to the death rates in these other countries, but all slight upward trends. And of course, these are going to catch up with their cases, unfortunately, before too much more time has passed. Now, I'm going to finish now. I've got other things to say, but I think that's enough. I'm going to finish with a report from Gil, who's kindly recorded a special report from Brazil. And we've looked at South America recently. Things aren't good there. Brazil suffered tremendously. And I'm afraid Gil's report is not particularly pleasant listening, but it is the reality of the situation at the moment, unfortunately. Thank you, Gil.
Good day, everyone. Today is Wednesday, the 14th of July, and this is a quick update on the last 24 hours. We had 47,000 new cases, 1,613 confirmed deaths, bringing the total to 536,000. As you can see in the graph, we are just coming out of the second wave, but the Gamma variant is coming full force, and anytime soon we're going to see this graph showing the increase in deaths caused by the Gamma variant and the problem is our vaccination rate is just way too slow. We're below 20% of the population vaccinated with 2 doses. And this graph shows that we are going to have to start the third wave from a very high plateau. We just surpassed 1,500 deaths per day in the last week, and this is not going to be decreasing anytime soon. So let's see what tomorrow's numbers are going to bring us. Thank you for watching.
Thanks very much.
Good day, everyone.
No.
Today is...
Thanks so much for that, Gil. Very kind of you to send us that report. 1,500 people dying a day, and Gil predicting there it's going to go up. A total of 536,000 deaths in Brazil. So, Middle East, South America. I'm afraid the next few weeks are going to be are not going to be good, to be quite honest. UK, more hopeful. United States, definitely a big summer surge coming, although hopefully with a relatively higher vaccination rates in the States. Deaths will be much less in relationship to cases. But poor parts of the world are going to have a difficult time over the next few weeks. That is the current reality. Okay, on that note, Gil, thank you for that report, and thank you very much for watching.